another, key thing I think for your audience is, maybe having, I don't know if you see a lot of this, but I would imagine there's certain people where you're doing the removal and it's a hard process. Like the removal, they don't handle it maybe as well. Is that true?
Right. So I think, from a neural standpoint, this is a very stressful event that, a lot of people would do. They would be benefited greatly by going through EDMR or other therapy to help them, because if someone goes back to a traumatic state, when we'll say in this instance, it's a physical appearance, it creates somewhat unwanted memories from surfacing. So you could get in a very bad neural loop. And we see that a fair amount.
Well, and another link here that I hear in what you're saying is when we're thinking about, the limbic system and that stress response and the need to do some of that neurological reprogramming, it brings us to that conversation of sympathetic, of that fight or flight, adrenaline, nervous system overdrive. And we often see that adrenaline is something that makes the biofilms of Borrelia, the bacteria that causes Lyme. It makes the biofilms stronger, and it can actually lead to the biofilms creating a better cell-to-cell communication network between all the different Lyme bacteria. Well, what do we do in microbiology when these bacteria communicate better together?